Does life, or rather consciousness, continue after death? Humans have been asking this question for thousands of years. The only way a person is to really know the answer is, of course, to die first, as there is no concrete evidence to support either side of the matter while we're alive and well. Although the answer to this question is inconclusive, people certainly have their opinions. In many religions, life existing after death, whether through reincarnation, living as spirits, or going to heaven, is a common belief regardless of any evidence to support this preconceived notion. The Pam Reynolds case is one of the most widely documented in near-death studies because of the circumstances under which it happened. Reynolds was under close medical monitoring during the entire operation. During part of the operation, she had no brainwave activity and no blood flowing in her brain, which rendered her clinically dead. She claimed to have made several observations during the procedure, which later medical personnel reported to be accurate. Reynolds reported that during the operation, she heard a sound that seemed to pull her out of her body and allowed her to float above the operating room, and watched the doctors perform the operation. She claims that during this time she felt more aware than normal, and her vision was more focused and clearer than normal vision. She also says she was able to identify surgical instruments and hear conversations between operating room staff. The fact that near-death experiences happen isn't in dispute. The sequence and type of events which they're composed are similar enough among people who report them that NDEs could be even considered a syndrome. Just because millions of people have experienced these NDEs doesn't mean that the most commonly believed explanation for them, that our souls or our mind leave our bodies and encounter God or some other sort of afterlife, is correct. After all, people misinterpret experiences all the time. Without a doubt, many people who report NDEs are profoundly affected by them. However, usually more because of their interpretation of the experience than because of the experience itself. There are many theories leading psychologists have come up with to explain why this might be the case. The biggest of psychology experiments conducted on this matter is of Ronald Siegels, who was an American psychopharmacologist. The experiment, rightfully named The Psychology of Life After Death, was published in 1980. During the 1970s, reports of life after death experiences had started accumulating in a short period of time, where accounts of hundreds of individuals claiming to have experienced something bizarre when they were closest to death. These experiences included visual and auditory information. Siegel's explanation for this phenomenon was that out-of-body experiences are common in a wide variety of altered states and hallucinations. He claims that the auditory information experienced by the patient may be as a result of dissociative anesthetics, where sensory input is sent to the brain as a result of the anesthetics the patient is given during surgery. Another explanation as to why people have these near-death experiences is given by Kevin Nelson. In his book The Spiritual Doorway in the Brain, he notes that normally 20% of the heart's blood flow is directed to the brain, but it can drop as low as 6% just before we fall unconscious. In many of these near-death experience accounts, the individual is usually unconscious. When our blood flow pressure drops so low and we faint, the vagus nerve converts the human mind from conscious towards REM. During REM, or rapid eye movement, in our sleep cycle is where we have our dreams. This correlation between the dream state and the REM in unconscious patients may be the reason as to why people have such extraordinary encounters. Paul Bloom, an American psychologist, has his own theory. He suggests that the general population's belief in the life after death is due to something he calls intuitive dualism. Humans naturally think of themselves as having a mind or soul that is not identical with the body. In his book, Descartes' Baby, he argues that the conceptual systems that make sense of minds and the systems that make sense of physical bodies have different conditions that trigger their activity, generate different thoughts, and have distinct developmental pathway in childhood. Consequently, it is easy to think of bodies and minds as only being loosely connected, as the idea of the afterlife is entertained by humans. In terms of a psychological standpoint, the idea of life after death is invalid, as not enough concrete evidence from multiple studies support the conclusion of this idea. Perhaps we'll never know the answer to this question, but it is important that we don't